Guys, welcome to my YouTube channel Ayurveda Basking. So today we are going to discuss our Agada paper and most important MCQ. With that we will discuss some important concept also, like which we have a probability to ask in the exam. So let's start with our first question, and the first question is, according to Cherka, the number of Visha Vega. So according to Cherka there are 8 Visha Vega, but according to Vagbata and Sushruta there are basically 7 Visha Vega are mentioned. Then next question is, which of the following is not explained Chaturvimshati Upkarma? So Chaturvimshati Upkarma, I have written the shloka here. You can see mantra, arishtam, utkartnam, nishpidnam, चूष्णम अग्निप्रिसेकम अवगाहम रक्तमोक्षणम वमनम विरेकम उपधानानि हृदय आवरणम अंजनम नस्य धूमम लेहम औषधम प्रशमनानि प्रतिसारणम प्रतिविषम संज्ञा संस्थानम लेपम. So out of this Basti is not coming, so it is the right answer. Next question, it is somewhat confusing topic and many times MCQ came from this portion. So I have written all the possible type of MCQ from this portion. Neela Raji is commonly seen in, and the right answer is Visha Mishrita Mamsa. But you can take the screenshot of this thing. According to Vagbata, there are around 10 things that mention in the liquid form, which having different color when they are mixed with the Visha. So we can identify whether it is mixed with the Visha. Out of this, there are some trick like for example, when Grita, if Grita is having a low quality, generally what we will say we will say it is looking like a water. So when Grita is having some Visha property, it will looking like a Paniniyam Shanninibam. And if Mastu is having somewhat Visha property, then it will look like a Kapot Varnam. And this Madhya and Tushodukam will appear like a Krishna Rekha, blackish color. Our Shodra or honey will look like green color. So honey, green. Like this you can make some trick and remember this 10 ingredient, and maybe there are chance like they can ask about of this any one of this, which type of color they will show. Next question is, Dushi Visha is originated by. So Dushi Visha is actually originated by maybe Sthavara. I have written the T word here from the shloka. It may be from the Sthavara, Jangma, Kritrima, Deham Ashesha, means which is not eliminated out of the body properly, and Jeeram, which is in the undigested form, and Visham Oshadam Ganam Abhividam, that is having a low potency due to the antidotes and all, Dava Agni Atapa Avshoshitam. So all of this will be the right answer. And according to Garavisha is basically due to the combination of poisonous or non-poisonous substance, and generally it is known as Kritrima Visha. Which of the following is not a Updrava of Ashmari? For this I have given one trick here. There are 16 Updrava according to Ashtanga Samgram that is mentioned. Like this Kasa, Swasa and Hikka, they will come together. So Kasa, Swasa and Hikka. Then if a person is having so many like thirst, then he can have a chances of fainting. So Trishna and Murcha. Vami, when upward root is having the motion, and Atisara went downward. So Vami and Atisara. Then Atisara and Vibandham. And there are two type of Shula is mentioned, Basti Shula and Siras Shula. Along with that, some characteristic of Varna is mentioned, Shavedu, Puti Damsham, Raktasravam and Nishvatam. And along with that, Javra, that is a systemic manifestation is happening in the Upadrava of Visha. So out of this, Ashmari is not coming. Right answer will be the option A. Diatoms are seen in death due to. So diatoms are seen in the drowning, and they are used for anti-mortem, means death before entering into the water, and they are found highest in the lungs and bone marrow. The line of treatment explained in Abharana Visha is, Abharana Visha means the poisoned ornamental, and is having the same line of treatment as of Paduka Visha. Like this, some other principles are also mentioned. For example, for Jivha Nirlekhanam, same treatment management is for the Danta Kashta, and for comb, same is for Shirobhyanga, Shirasthanam and Snanam, riding on the animal having the same treatment principle as of the Abhyanga Visha. Which of the following Agada is specifically indicated in Gara Visha Uphatam? So Gara Visha Uphatam is basically your Murvadi Agada, and the Shanga Agada is for Sarvakita Haram, and this Pancha Shirisham is Sirish is actually having a Vishagana property, through the Dravya aspect, it's having a Prabhava of Vishagana, so it is known as a Vishanam Pravaram. And in Pancha Shirisham Agada, basically we are using the 5 part of Sirisha plant as and make it a Agada. Next question is the rain drop pigmentation seen in which poisoning? Actually, right answer is the arsenic, but I will give you one important and short trick through that you can remember maximum things about the arsenic. So it is from the name itself, arsenic, and then you have to remember 3G extra, GQ. Okay, so let's start. First is arsenic. A is go for Eldridge mess line, that is seen on the nail of the person. Second is R, there are 4 R, raindrop pigmentation is there, red velvety appearance on the postmortem of stomach mucosa will be there, rashes will be there, and rinse test is done for the diagnostic of this arsenic poisoning. Then S goes for subendothelium hemorrhages, E for excessive pigmentation of the palm and sole, then N is for necrosis, tissue necrosis is there, and I for iron oxide because its antidote is ferric oxide, C for cholera, like that's why sometimes there may be the misconception whether the arsenic poisoning or a cholera. So cholera is having its differential diagnosis. Then G for garlic smell is there in arsenic poisoning, G for golden hair, person will having a golden hair, and G for Gust's test for diagnostic. And in poisoning cases, if we have to take the sample, if this is an acute poisoning case, then you can take sample from the liver, and in chronic you can take from the bone, because this arsenic will deposit in the bone. So this is maximum point we have covered in this trick of arsenic. Next is total number of Raji Manta Sarpa. Raji Manta Sarpa actually 10 are number. Maximum Sarpa are Dharvikra 26, then Mandali 22, and Nirvisha is 12 in number. Which of the following is not a opium derivative? So morphine, codeine, heroin, all are the opium derivative, but hyoscine is not a opium derivative, and it is a Dhatura phytochemical. Medical jurisprudence deal with the, so it is basically dealing with the medical aspect of the law. Examining the patient without consent is known as, so if you examine a patient without his or her consent, that is known as assault or battery. Then magistrate inquest is conducted by, magistrate inquest can be conducted by the district magistrate or executive magistrate or subdivision magistrate. So right answer will be the any one of this. Which among the following changes after that is indicated as postmortem caloricity? Postmortem caloricity means after the during that postmortem or after that, the temperature of the body start increasing. So that is known as increased body temperature, and cooling of body is known as the algor mortis. Next question is, according to the Sushruta, the symptom of Shiroruja and Akshiruja is encountered in Visha Yukta Vayu. Obsession is a disorder of thought. Transplantation of Human Organ Act was enacted in 1994. Then this question is Jayapala is an ingredient of Ichha Bedi Rasa. We have already given our R&B paper. In this R&B paper we have studied this Ichha Bedi Rasa, in which we are taking 3 parts of Jayapala. Then incest is basically referred to the sexual intercourse of a man with a close relative. That sentence can be given by the session judge. Right answer will be the session judge. Then which of the following is the antidote of Bhallatka Visha? So this Bhallatka Visha, we are using this jaggery, go dugdha like, but for antidote is generally Vibhitiki is given. And the B option, this Ishtika Churna is basically for the purification of Bhallatka we are using, and Tangna is the antidote of our Vatsanaba. Forensic medicine deals with the medical aspect of the basically legal aspect of the medicine is done in the forensic medicine. Marma Bandha Chedna is a karma attribute to which guna of Visha, and the right answer will be the Tikshna guna. And Marma Ghata is due to the Vikasi guna, and due to this Ushna it will increase the Pitta. A period of complete sanity between the episode of insanity is known as a lucid interval, in which person is temporary healthy. Botulism is caused by which type of bacteria? To Clostridium botulism. Then intake of food in open places and come under which type of viruddha? So actually it is a vidhi viruddha, in which we are not following the proper dietetics rule. Which sample is best for diatom test? And so out of this, bone marrow is most appropriate because diatom is deposit also in bone. Then which among the following is not used for Hridya Avadam? We are using Shira, Grita and Shodram. Dadi is not used. Right answer will be the option B. Oleandrin is an active principle of which plant? Oleandrin is basically Caravera. If you know the botanical name of this plant, you can easily decode this answer. Accuracy in sexing adult sex in the adult skeletal remain is done according to Krogman's rule. We are saying like pelvic bone we are using for 95% of sex determination. Then ground on which medical termination of pregnancy is done, and the reason is given failure of contraceptive measures is that is a humanitarian. Rule of 9 is used to assess. Rule of 9 is used in the burn cases, and we are basically estimating the area involved in the burning. So right answer will be the option C. Specific antidote for opiate poisoning is naloxone. All of the following are the cardiac poison except, so aconitine from the Vatsnava is our cardiac poisoning. Then oleander from Caravera is also a cardiac poison. Nicotine from tobacco is also a cardiac poison, but Datura is not a cardiac poison, and it's having basically CNS depressant action. Which among the following is an ingredient of Dushi Vishahari Agda? So out of this, Agarika is having as an ingredient in Dushi Vishahari Agda. Kevorkian sign is seen in, Kevorkian sign basically seen in the retinal vessel after the death around 30 to 40 minutes or 1 hour. The blood vessel in the retina start tucked off and known as the Kevorkian sign. Rice water stool is a typical feature of poisoning due to arsenic. In our trick we already seen this 4R. Privileged communication is made between the doctor and the patient. Next question is the Visha is having the guna opposite. So as we know that Visha is doing its action because it's all having the property opposite to the ojas, and it's basically destroying our ojas. How many Visha Upkarma are described by the Acharya Charka? 24 Visha Upkarma are mentioned. Vishamam Ashri Mishritam Shira appear. In our previous table we already completed this portion. So it's having a basically tamara or copperish color. According to Vagbata, which of the following is considered as Kritrima Visha? In previous question also I have told this thing, like Gara Visha is somewhat considered with the Kritrima Visha, which is basically the combination of two poisonous or non-poisonous substances. Which of the following is the Updrava of Visha? So in Updrava I already mentioned Udra, Amavata, Ashmari, they are not Updrava. Only Puti Damsha is one of the 16 Upadrava. In typical hanging, note is found in the occipital back of the neck. MCE1 sign is basically seen for hydrocephalus and all condition, and specifically in this alcoholic intoxications. The Shanga Lepa is specifically indicated in Kita Visha. Mina Mata disease, so आप ऐसे याद रख सकते हैं. You can remember like that. Mina Mata, M with M, mercury it is used. So it's one of the disease or disaster of mercury that happened in 1956 in Japan. Leading questions are permitted only in cross-examination. In examination in chief, dying discretion and re-examination, no leading question are permitted. Ganja is one of the preparation of cannabis. Cisplatin is one of the anti-cancerous drug, so it is basically used in the chemotherapy agent. In an emergency involving children, when their parents or guardian are not available, consent is taken from the person in charge of the child. This is known as a loco parentalis. Death sentence cannot be passed by the magistrate court. It can be passed by the session court, high court or supreme court. Next question is most common fingerprint pattern in Indians is loop pattern. Klinefelter syndrome is basically for XXY, in which one X chromosome is more in female, in male genotype. Then delusions in disorder of, so delusions is a disorder of thought. Right answer will be option A. MTP Act was passed in the year 1971. The term respicia locutor means the fact speak for itself, and basically it is explained in case of negligency cases. Lesbianism is also known as the tribadism. Next question is Hetu Linge Prashamne Roga Nam Apunarbhave, and this is basically the shloka giving for the Rajavedya. Right answer will be the option C. Sexual gratification obtained by suffering of pain is masochism. Murvadi Agda is indicated in the Garavisha. Next is an extravasation or a collection of the blood due to the rupture of the blood vessel caused by blunt mechanism force without the loss of control is basically bruises or contusion. Following is the medical legal aspect of bhang, and right answer will be the ren amok. Tobacco is the example of inebriant poison because it's having the chemical constant named as nicotine. Questioning of witness by defense lawyer is permitted in cross examination only. Rigor mortis at delivery suggests stillbirth. Example for the best homicidal is aconitum because its vasnama is having a sweet taste. That's why sometimes it's also misguided as other vegetable foods. Then gastric lavage is contraindicated after the ingestion of corrosive poison, CNS stimulant and convulsant poison. Atite Panchame Vege Saptamasya Antadige is the time indicated for Patti Visha or antidotes. As per Visha Adhishtana, Sushruta considered Karavira under the Moola Visha. Bhavana with Adrak Savrasa for 21 times mentioned basically for this Ahifena, Papaver somniferum. Crate belong to the family Alidipe. Then uske then dimer caprol is the synonym of bal. British anti-Lewis antidote. Then according to Astanga Samgram Visha of Drivar 16 number, we already seen what are the 16 this. If a person habituated to Katu or Ushna Rasa and then he convert to Madura or Shita Ahara, it is known as a Satamya Viruddham because he is changing his Satamya. Which of the following is not a sign of rabid dog? So according to Shushruta, rabid dog is having the Prasart Languna, Ati Lalastrava, Atirtham Andan Badiram, but he is not having Ati Shuddha Lakshana. Right answer will be the option C. Sin of Gomor is mentioned for bestiality in Bible's rule. So here our 80 best MCQ is completed. Thank you guys.